All right, good morning everybody. Nikki Burnett here, Taste Life Nutrition. This is Taste Life Nutrition Radio, streaming live on KUHSdenver.com, where I need to turn my speakers on. And so today is going to be super cool. Today is going to be a really fun session on a topic that is not well enough discussed. Why? Because it can be embarrassing. It shouldn't be. You know, health is life, and part of life and part of health is healthy sex life, right? And I think it's really important to understand that if there is dysfunction in the sex life, then there's probably dysfunction in other places. And so we have on again for the second time Dr. Diane Mueller, who came on the first time talking about Lyme, right? And the crazy scariness of Lyme disease and how hard it can be to deal with and what it is that we can do, because it is very treatable. Yes, it's just really freaking hard. Yeah. Yes. It's really, really hard, which is why we have specialists and things like that. But I'm so excited to hear the story of how there's the pivot or an expansion, right? Expansion into libido and what it is that we can do, why some of us have, or a lot of us have an unhealthy libido, what we can do about it, and how exciting it is that we can sit here and we can talk about it. I mean, I think it's a really, really important topic to talk about, because we talk about a lot how symptoms are the body talking to us. And if you don't think that a low libido is a symptom, or maybe even an excessive libido is a symptom, then, you know, we need to take a step back and say, okay, what is my body trying to tell me? So I'm going to stop, and thank you so much for joining us. I'm so grateful that you're here again.
Oh, thank you, Nikki. I'm really excited to be here as well, and I'm really looking forward to talking about this topic. It's so needed, like you said.
It is. It really is, yeah. So, of course, as always, we start the show with gratitude. Gratitude can change the world. I truly believe that if we take a little bit of time to reflect on the things that we have to be grateful for, I think that it can change. It can change in our own lives, but it spreads. So, what are you grateful for today?
Today, I'm grateful for the rain.
Oh my gosh.
We're having a lot of rain this week, and you know, here in our dry climate in Colorado, where there's so many wildfires, right? And last year for the past couple of years, we've had some crazy things happen here in the city, where it's wildfires have not just been in the country, in the mountains, they've been happening in our local communities. So yep. I really feel like, you know, just celebrating the simplicity of the rain and helping prevent against some of the crazy wildfires we get in the state and in the city is a really important thing. So that's what I'm grateful for today. How about you?
Yeah, that's such a good point. It's funny because I am very much a summer sunshine girl, and I literally have to take a step back and think, thank you God for the rain, because I know we need it, even though I want the sun.
Yeah. Don't we all?
I know. So I am grateful for, you know what I think today I'm really grateful for are the amazing women I'm surrounded by who are here to help to lift and to guide. You know, that's really what we want to do with this show, right? We want to bring on people who are here in this world to be of service and are lifting others up and helping to guide, and whatever their gifts are, they're sharing their gifts, which of course is why you're here. But I have such an amazing support system of women, whether it's for my own health, which my health is pretty good, but and men too. But you know, right now it's just kind of, you know, I'm grateful for the women, the women who are they help to guide me in my business, guide me in my health, guide me in whatever it is that I might need, because I know that being lifted gives me the ability then to lift. And, you know, that's something that we talk about a lot. You know, we talk about needing our team around us. And I think our team, yes, we have our health professionals who are our team, but your team can also be those who are just there to support. You know, see outside of what you see. It was a couple of days ago, it just came to me, but I'm not going to remember what it was. I was listening to a speaker, and she said something. I think she said you can't see the label from inside the jar, right? Yeah. Something like that. I was like, oh, that makes so much sense, and it's true. When we're sitting here, sometimes I need somebody who's outside of me to help with whatever it is. So I'm really grateful. I have a really great community around me. So that's what I'm grateful for. So.
Yeah, the other way I've heard that described is you can't see the picture from inside the frame.
Yes.
And right? It's like similar, it's basically a different analogy for showing the same thing. And I think it's such a great thing to bring into light around gratitude with our topic today, because we actually see that, like, when we're talking about libido, we're talking about sexuality, this has become this taboo topic due to culture and religion and society and, the media. And a lot of healing can happen when we just talk to others and we begin to normalize these types of conversations and realize that we are not alone in whatever our struggle is and our understanding or not understanding of libido, of orgasm, all these things. So celebrating your female community, I think, is like a perfect thing for our topic today.
Yeah, totally agree. So quick question, just so I can make sure that as we're moving forward, I'm asking, we're chatting about the right thing. Are you working only with women or with men and women?
I am working only with women.
Okay.
Yeah,
okay.
Absolutely.
That's kind of what I thought. Yeah, but just wanted to make sure.
Yeah, and part of that is rooted in, I do a lot of discussion forums and these sorts of things, and the idea with this is like making it feel safe for people to bring in their questions and their concerns, and by keeping it a cohort of people that have similar types of problems and struggles and and questions, it really just creates like a container that feels a lot safer when it's full of people that are kind of just like you. Yeah. So that's why it's, for women only.
Great. Yeah. And that would be expected, but I just wanted to make sure for clarity's sake, right?
Yes.
So let's start with, we know, at least some of us know about your history. I think, though, that we go ahead and give, a little bit of a dive into your history, because it is your history that has brought you to where you are today, even though from the last show we did, it has expanded into this show, a little bit different, or a lot different, but always connected, right? Our stories are what bring us to where we are in life and what helped to build us. So I'm super curious. Would love for you to share where you came from and then how that transitioned into healthy libido.
Yeah, thanks. I'll start with this part. I know I've shared some of my Lyme story, but I'll start this part of the story with some things I haven't talked about before, which are, I had a very, very Catholic upbringing, and while this is not to talk religion or not religion, it's more to just say that kind of put me feeling a certain way, framed my sexual relationship in many ways. And because of that, and because of some of the way that I was taught from a religious standpoint around sexuality, I really felt very confused about sexuality. I felt kind of unsafe to explore it. When I explored it, I didn't know what to do with it, and how to explain what I was feeling and what I was not feeling, what I was confused around. So I had my own level of confusion around my own sexuality, my own libido, how to be healthy with a libido, that sort of thing. And, from my own standpoint, I tried all sorts of things. I tried open relationships. I tried, monogamous relationship. I tried a lot of different kind of variations of even what relationship looked like. And that was so useful for me to teach me around communication, things around communication relationships, how to deal with jealousy in a healthy way, how to form types of relationships where we can talk about how we feel about these complicated types of topics. So it really led me down my own personal, I feel like my own, libido, my own sexuality is something that I've explored in so many different ways personally. But that was always just kind of a personal thing, right? It didn't become a professional thing until almost accidentally. And I say accidentally because I didn't seek out initially working in the libido space, but what I began to find in my own work with Lyme, with mold, with some of the chronic diseases I work with, is libido comes up all the time. And it's almost, I wouldn't say it's every patient by any means, but it's probably 70 to 80% of my patients that are coming in with chronic illness were actually working on libido. And what became interesting about it is as we began to work and untangle the root causes and talk about the relationships and talk about safety and work on the psychology and mindset, everything that we do in chronic illness, one of the things that started happening is libido started improving, relationships started improving. Right. So it really was my own kind of clinical accidental work in, say, treating libido, while it was not my initial focus, that led me down to say, okay, well, now it's time to do a lot more research, a lot more reading, understand sexuality in a completely different way. And thus the Libido project has been born.
Amazing. I love that. Yeah. And so I would imagine that people come to you when they're suffering from chronic conditions, but it's a whole different way of approaching women who maybe don't realize they're suffering from a chronic condition or don't understand anything. But the sort of the key factor is, where the hell's my sex drive? And so I would imagine there's still that approach, like you said. You got to uncover the root cause. You got to understand what's going on. What's the body trying to tell us? What are the factors that are creating the dysfunction in the first place? Which, low libido is dysfunctional, and it's reaching a broader view, broader scope of people who need your help.
Yeah, and I think what you said initially in kind of the intro to this show around like low libido is a symptom, right? Mm-hmm. Like low libido can impact us in so many different ways because it can impact the health of our relationships, right? It can impact how our family, if we have a family, how we feel in our family unit, that connection we have to our partner, all those sorts of things. And it is a symptom. It can be related to maybe why blood pressure is not regulated, why blood sugar is not regulated, why hormones are out of balance, like why there's inflammation and pain in the body. All this can be connected. Yeah. So there's a kind of two parts of like the passion project around this, and one is helping people see that this is a symptom and this is your body talking to you about an imbalance that you would benefit from actually fixing in many areas. So secondly, this is an area where if it's fixed, you can actually improve your relationships, you can improve your health, you can improve your family unit, all of these different things. And one of my favorite things about really working on libido is what it does for stress and the ability for it actually to help modulate stress, modulate cortisol. And that's huge because stress is probably one of the most talked about words, right? One of the most talked about things in health and wellness. And here we have this really fun and natural way of actually modulating and helping and lowering our stress. So that's another really great life, advantage of working on your libido is teaching your body how to actually manage stress better.
Yeah, so there are a couple of things there. One, I think, is kind of this, it's a little bit of a paradigm shift. When someone says, I just don't have the sex drive, is really thinking, what is this and why is this happening? This is what, I teach, is what you teach, is what, any of us, especially, in the functional medicine, functional nutrition world are going to teach, is what is ask why. Always ask why. And there's so many factors that can be involved in, what's creating this, but we have to learn to dig. And I know not everybody can dig, but that's why we reach out to people who study this, right? Who are the specialists in these things. I say this all the time, but I give away my bookkeeping because I'm terrible at keeping books. And so we have to find the people who are the specialists at what they do who can help us. To the stress piece, which maybe is kind of where we start to dig in a little bit, which I love because stress is this word that's all around us, right? And if we don't really understand it, we're like, I'm not stressed. I feel fine. People don't realize they're stressed, but it is the, sort of this ugly, it's a spiral, or it's all these, I see it in my head as connected bubbles, right? We always, probably in when we're, being trained on these things, it's all of these connected bubbles with arrows going to the different bubbles and then back again. So it's stress that creates inflammation, which creates more stress, which creates disease, which creates thyroid dysfunction, which creates more stress, which creates libido dysfunction, right? And they all go back and forth. And so much of it is that the stress just gets higher and higher and higher and higher. And it's the stress that's creating the problem. But we still have to think, why is all of this happening? And it goes back to having to dig. So I love that, because it is stress relief. It is a time of, I don't know, I'm just thinking about this. Will it put our body into sympathetic or parasympathetic?
So what we actually see is happening from a hormonal level, and this happens really through the utility of oxytocin. And I'm going to take a step back before I answer that, before I go further, because I think one thing I just want to say here about the stress, like I feel like stress and inflammation like have a level of similarity in how we talk about them, right? Like inflammation, sometimes we talk about like our inflammation bucket. We talk about this with toxins too, right? So it's like we have inflammation and toxin coming into our bucket, and it's all about the body's ability to remove toxins and inflammation from the bucket. And if the bucket gets full, that's when we really get symptoms. And in many ways, like stress is the same way, right? Like no human gets out of having stress. So it's all about almost our stress bucket. How much can our body handle where it can still manage it, and it's fine, and it's not creating destruction and tissue breakdown and emotions that are very hard to regulate and taking over our life and affecting our sleep, right? Because our bucket is emptied at a rate that our bucket is filled. So when we're talking about sex and we're talking about using sexuality to modulate stress, in part what we're talking about is its impact on the hormonal system. So like oxytocin is getting a lot more of a reputation, right? And it's kind of thought as the cuddle hormone and the love hormone. And the two things in intimacy, the two times we really see oxytocin being released in real high amounts is one, like just through touch and cuddling, right? So even just the act, even if you don't get to orgasm, is going to release oxytocin. But then secondarily, at orgasm, that's where we get even bigger oxytocin release. And one of the things it's doing is it's actually lowering cortisol. So the nerves are affected in different ways. So it's difficult to, in some ways, say it's totally parasympathetic or totally sympathetic, because we have some level of vasoconstriction, some level of vasodilation happening at different parts of the body. But what we do see is we see oxytocin is actually lowering cortisol, our stress hormone. And so it's able to modulate that. We see dopamine come up. So it's able to help with happiness and euphoria, right? We see that melatonin can be secreted. So it can help us with our sleep, right? So there's a lot of different things that can really happen with the process, and with the whole process from start of foreplay all the way to actual orgasm. There's a lot that can happen with oxytocin and modulating stress. So it's not just about like, oh, let's actually feel good. That's some of it, but it is that we're actually seeing oxytocin have this downstream change on many of our other hormones, including our stress hormone cortisol.
That's so interesting. I love that. And it's if we pay attention, we feel it, but I think so often we forget to pay attention, right? If we're in the mood. Then of course,
exactly.
If we're not in the mood, maybe that's where we go from there, is what are the reasons, so I'm thinking as far as hormonal dysfunctions, we've got the xenoestrogens and the metalloestrogens, which are these, estrogen mimickers that are in our food and in our air and in our water. Let's kind of expand on that. What are the other things that can create this hormonal dysfunction that can be so problematic, and it's everywhere?
Yeah, it's everywhere. It's everywhere. I mean, absolutely we need to think about from a hormonal perspective of the different types of estrogens like you're mentioning. Truly from a libido standpoint, most commonly what we see in the literature is that estrogen and testosterone play roles. Progesterone doesn't seem to play as direct of a role in our libido, although progesterone helps us feel good as women, right? So it we do see, for example, a link between body image and even genital image, how we actually feel about the look of our genitals. We see a link in research between those things and libido. So from a progesterone, like make us feel good, hormone balance makes us feel good, we could say that progesterone maybe has a loose connection to libido, but estrogen and testosterone definitely show up way more in research as far as direct connections to libido itself. DHEA also, which is that precursor to those hormones, to estrogen and testosterone, DHEA also plays a role, especially as we age. DHEA and libido are connected. So, when we're looking at hormone balancing, then to take it back a step back, as I know we both like to do, to like why, then we start saying, okay, well, why do we have estrogen imbalance? Why do we have testosterone imbalance? Why do we have DHEA imbalance? Why are these hormones low or high or whatever is out of balance with them? And then it comes down to what's going on in our gut, what's causing inflammation in our body, what's happening with our liver, what's happening with environmental toxins, are we getting the right nutrients? And that's, these types of root causes are why, I ended up in the libido world as a second part of what I do, because like I said, it's like we start treating all these types of roots and then all of a sudden the libido comes back. And that's because of the mechanisms of, okay, we get the liver detoxing, we get the toxins out, we get the bugs out of the gut, we work on the other underlying causes of inflammation, and all of a sudden our libido can start coming back.
Yeah. There's something that I want to hit on. It's not really off topic, but it does have to do with both men and women, and I think it's important to understand first, because cholesterol medications, statins, are the number one prescribed drug for men and women. It's crazy. And so as you were talking about, DHEA and progesterone and then your androgens and estrogens, and so there is a pathway that all of these hormones go down. It's really beautiful. I love, looking at like Dutch tests. You can see these pathways that it's all working down. So this is what I'm seeing in my head is labs. But what's not shown on there, so it shows that our master hormone is pregnenolone, right? And so that's where it starts. Then you have all this beautiful cascade of hormones that come down that we're supposed to experience, right? Hormones are communicators. Above pregnenolone is cholesterol. And so I want you to think that if you are taking cholesterol medications, what is it doing to your hormone levels? It's probably impacting them significantly. So really something to think about as far as if you're taking a statin, ask the question why. Is it truly necessary? I'm not saying that it's not, and I'm not saying that you need to go get off of your statins, but I'm saying that you always need to ask the question why and understand what this medication is doing to your body, to your hormones, to your muscles, to your brain tissue, all of those things. But we need to understand that with all of the medicines, the supplements that we take. It's important to have an understanding, and those who are telling you to take these things, make sure that you trust them. So if you want to add on to that, that's great. But I just think it's really important for people to understand what can happen here.
Yeah, and the thing I would add is like, while obvious, there are certain times where it's like, yes, we can see that link between cholesterol and coronary artery disease, although much of the time what's happening here is an oxidative type of mechanism. It's cholesterol in the blood vessels, and the cholesterol is mixing with toxins and free radicals that are causing this type of reaction. And it's not having enough antioxidants, right, that's really causing this cholesterol to cause things like coronary artery disease. And so I think, your point's really important around, we're not saying yes or no statins, like that's a, conversation for you and your doctor. Yeah. But what I think is like really concerning is like, sometimes I hear doctors say things like, we should put statins in the drinking water.
Yes.
And right. And like, that is an insane thing, because so often it's like we're talking, the side effects of statins, we're talking about things like muscle cramping or these things like that are like commonly talked about side effects. But what's not being talked about is what we're talking about here, like all of the downstream dysfunction that happens when you lower your hormones, which we can see happen because of this, this pathway that you're talking about around cholesterol turning pregnenolone, turning into all these different hormones. So I think it's just an important thing to really, it's like if you are on these medications, like really make sure that you need to be on them. A lot of people don't. They're hugely overprescribed.
Yep.
And secondly, if you do, then, work with somebody that can help with modulating your hormones and help you with that, because there is going to likely be a downstream effect that's going to help your hormones or hurt your hormones in these other ways.
Yeah. So I think it moves us into inflammation, right?
Yeah.
And so that's what, cardiovascular disease is. It's an inflammatory condition, not a cholesterol condition. So, not necessarily anyway. So, talk about, just take it from there. And, the chronic conditions that we deal with that, that are inflammatory, and then just affect everything else, including our sex drive.
Yeah, I mean, there's so many different, areas that we're really talking about here.
Yeah.
So from a standpoint of even things that I commonly treat in my Lyme practice around like mold toxin, toxic metals, glyphosates, plastics, all these different things. Like we make hormones, we process hormones, I should say. We process hormones in our liver. Our liver helps to break hormones down, helps us to metabolize them, recycle them, helps the balance really stay in that reference range, that therapeutic range that we want our hormone levels to be at. So when we're in situations where our liver is busy clearing out the glyphosates, clearing out all the other toxins, clearing out whatever it's clearing out because of the environment and what we're putting in, there's not the ability for it to properly recycle and break down these hormones, and we can see out of balance levels. So there's a lot, from that physical standpoint that's happening there, that's happening in the gut with hormones around, we have certain infections, and we have certain infections. They lead to increases of an enzyme that I know we both know, beta-glucuronidase. And when we have that can actually make us have higher estrogen levels. And, we don't want these things too low, too high. So, we have all of these different ways that, hormones are a component of sex drive and libido. But the other thing that I really want people to understand is like hormones and the impact of hormones, and even what's happening from the physical body, is really only one component of libido. Body image, genital image, connection, safety, like all of these different things are huge. And what can happen in relationships, even around safety, for example, like all these tiny little things that we sometimes in partnerships can brush under the rug around, like, somebody snaps at us, right? And like a partner snaps at us, and like everybody has a moment, we're allowed as humans to have a moment. But if somebody snaps at us and we don't bring it up, and we're like, okay, we're not going to bring up like the fact that, that we had an emotional response to that, and we talk about it and we resolve it and we forgive and we love and we move on, sweeps under the rug, we feel a little bit oftentimes unsafe.
Yep.
Right? And that happens again, and that happens again, and that happens again. And these tiny little baby scratches that go unnoticed can actually lead to a larger feeling of unsafe. And especially for females, there's such a link to feeling emotionally safe and interested in sex. It's a very vulnerable thing as a woman, like, to be a little more graphic, like to be penetrated. Like, that's a very, talk about the epitome of vulnerability. So safety is huge. And even if you feel like externally safe, there's a huge thing around, like, is there some level due to these small, tiny micro cuts that are normal in a lot of relationships that have led to a feeling of unsafety? So I'll pause because I know I just said a lot.
No. I mean, you say all you want, because I think it's amazing. It's so mental and emotional for women, and it's interesting. I love and I appreciate the differences between men and women. We are different for a reason. We are not the same, and and I appreciate that. But there's so many things that I want to say. I think for one, are you, with the safety issue, are you comfortable and feeling safe with communicating? Right? Are you communicating the whys and the hows and what's going on? And like you said, if you're sweeping it under the rug, obviously there's an issue with communication, and it's going to start to create those issues with intimacy. I don't know that I have anything to add. So yeah, keep going.
Okay. Yeah, I mean, another thing I'll say there around communication that is so important is like so many times in sexuality, unfortunately, the only way that most people are even shown anything sexual is in the porn industry. And, you know, some people have watched porn, some people haven't, but those people, either if they haven't, then there's like no, you know, portrayal probably of sexuality in life. And if you have, then there's kind of a crappy portrayal of sexuality in life, right? Because so much of what the porn industry has done for women is like, okay, well, this is how you're supposed to look in your body. This is how you're supposed to look in your genitals. And this is basically how you're supposed to get to orgasm in 5 minutes or less. And it's supposed to look like this. You know, it's kind of ludicrous. And so one of the things that I think can happen is like, then in like communication, because there's an image of like, oh, this is what it's supposed to look like, then if it's a hetero relationship and it's you know, man and woman, and man is like not performing in this way where it's leading to all these feelings in 5 minutes or less, then it's so easy sometimes to be like, you know, lash out or lash out in an unhealthy or healthy way and be like, this, you know, you're doing it wrong or there's a problem. And so one of the issues around communication, I think, comes down to the lack of understanding of what normal is, the lack of understanding that bodies are supposed to look different, genitals are supposed to look very, very different. All of this is supposed to be different and beautiful in their own unique ways. And realizing that oftentimes it's, you know, when it comes to exploring pleasure, I think that's what's confusing both for men and for women, is that pleasure is, especially for females, is so unique. There's 5 different erogenous zones that have been identified in much literature around like erectile tissue in women. And oftentimes we talk about 2, maybe 3 max. And, you know, and it's so difficult to know where they are, what you like, if you like being touched in these areas, if you don't. So a lot of communication really comes down to learning your own body, and then also don't have much communication around, you know, around sexuality in the middle of the act, other than like, you know, some basic things around like, oh, keep going, or, you know, that kind of thing. But when it really comes to wanting to explore around like how to make improvements, you know, what to do different, what I recommend there is like, you know, from a safety perspective, keep that actually outside of the bedroom act, right? So it's, you know, in a safe place, you know, be like, hey, I really enjoyed what was happening, and I've been studying some on libido and sexuality, and, you know, I love what we have going on here, and I want to see if we can even take this even like deeper and more profound, and, you know, can we talk about it? Like, you know, approaching it from a standpoint of like, not that anything wrong is happening, but like, here's what's right, and I want to make it even better. Usually takes, you know, helps settle the ego, helps settle that whole thing around like, you know, men tend to have this amazing, I love this component of the masculine so much, like this desire to provide, right? That's like deeply inherent in the masculine. So it's like really helping them feel like, okay, like, yes, you are providing, and this is wonderful, and here's how we can work together to give you even more of that feeling, for providing even more, taking me even deeper. So it's how we have and when we have and where we have these types of conversations, whether it's sexuality or whether it's emotions, you know, really making sure we're putting ourselves into this position for success makes a huge difference. And it trickles down to everything libido in the bedroom.
So how do we as women, if we're not sure what the cause is, I'm trying to figure out how to say my question, because I'm not really sure. If we're not sure what the cause is, we don't really understand, and we don't communicate well, what is it? I mean, my thought is, well, we join a program like yours because then we learn how to communicate. And I'm thinking that that's kind of, it's a relearning of what you need, why you need it, how to communicate it, and then doing it.
Yeah. I mean, and really it's like we can look at, you know, libido like we do so many areas of health, right? Physical, mental, emotional, spiritual, right? There's all of these different areas. And like, when we're looking at like physical stuff, we absolutely want to do things like we want to make sure the diet is clean. We want to make sure the toxins are out. We want to look for these underlying root causes, hormone imbalances, gut bugs, all these things we're talking about. So we absolutely want to do those things. We want to figure out, like, what is our body image? Like, body dysmorphia is such a huge problem in women, and this thing of like looking in the mirror and like we don't even see how beautiful we are, right? We don't even see our curves. And so, yes, I mean, joining programs like mine, we do work through all of these areas, and some area what we work through from like the body image, some area is doing embodiment exercises, because a lot of the challenge with pleasure and with sexuality for women is it's so easy. If you're everybody listening, like we are all on stage, I'd say like, let's raise our hands for everybody that said this, because, or that experience is what I'm about to say, that thing where you're in an intimate moment and then all of a sudden your mind is like thinking about the groceries or the kids or the work, right? Like I totally, like, this is something that I definitely don't want to admit to my partner. But yes, that happens, right? Sure. So that definitely happens. And so as women, though, how do we actually become more present in the sensations of the body? And, some of the ways that I have found personally really helped me drop in, that I help the women I work with as well, is actually understanding like pleasure and what the benefit of pleasure is doing to your own system. So like for me, I'm very oriented to like, the way that that I have like results in my life and efficiency. So if I know that if I can sink more into pleasure, I actually show up better in my work. I show up better in my relationships. I'm more calm. I have more patience. I have a happier demeanor. Then it's like, oh yeah, grocery list. Actually, what's happening in my body now? So there's like a motivation, because I understand it's not just about having an orgasm. It's not just about that moment. It's actually about the hormones that are generated during that and the trickle down effect that these yummy hormones will have in all areas of my life. So that's why understanding this can be really helpful, because in that moment where we're trying to sink into that pleasure more and not have our mind go to the list and all the things that are so easy to have happen as women, that we come back to remember pleasure. Oh yeah, this is why I'm doing that. And so then, back to the whole body image thing, some of that and some of the practice around body image and around pleasure also happens outside the bedroom. So activities like dance, I think I have found dance to be such a good activity, but like, whether it's dance or yoga or breath work or, even meditation, but something that's going to put you into the moment. And I don't even think meditation is always the best for this, because sometimes meditation, we just go into the ethers and we're actually not focused on the sensations of the body. It has its other benefits, but from a standpoint of like embodiment, what we're really talking about here is like teaching our body by using different techniques to actually feel our own sensations more, so that we're in that intimate moment, we're actually present to what's happening in our pelvis, what's happening in our genitals, what's happening in our physical body, what we like, what we don't like. And that practice really helps us not only enjoy the moment more, but then also be able to communicate better with our partner. And we do actually see in libido research that better self-image does actually impact our libido. And I have a friend doing a really cool project right now with consent, of actually taking pictures of women's genitals and then putting them, putting pictures of their vulvas essentially into like a book, again, with their consent, where you can start to see like, oh my gosh, they can be hairy, they can be not hairy, they can have lips, they can have like big lips and small lips and like bigger inner lips and bigger outer lips, and they can look so many different ways, color, shape, sizes, all these different things. And there's not like a right way for genitals to look. And this is a really important project, because what this is going, what this potentially can help do to, oh, this is actually how I look down there is normal. Right? This is actually normal, because we're all different and it's all unique and it's all beautiful. And that can even trickle down into libido. So it's really, answer to this, it's really just working with all of these different areas and working with, either a program like mine or a team of people that approach this from different ways that can help with physical, mental, emotional, spiritual components of this.
Yeah, I have found in practice, well, I think that when I first started practicing, the amount of people who have experienced some sort of physical trauma, emotional trauma, harm, and we know these things are going to impact us, and then at the same time, we've taken what is, like you said, normal and natural and beautiful, and we hide it, and we're afraid of it, and we don't want to look at it, and we don't want to talk about it, and then so everything just becomes secretive and and it's sad is what comes to my mind, because it's not like your toe is not a part of your body. Not everybody has a pretty toe, but it's a toe, right? And it's the way that it's supposed to be for your toe, and it's the same with every other part of your body. It's just a part of the body, and it has a function, and it's there for a reason and to utilize.
Yeah, it's true. And the trauma part, I think, is really important to bring up. Like I've gone through that. I was date raped when I was 19, roofied. It was like,
Jeez.
Quite a crazy thing to get over. And that's, it's something that I have a lot of, compassion, obviously, from a personal experience of like how this can trickle down, right? And it's so common. And it does, from a trauma perspective, whether it's something like that, whether it's more emotional trauma, whatever it is important to work with somebody that's trained in how to help recover from that. And it is recoverable, it's definitely recoverable, but, working with somebody that is trained and how to help navigate. I had an amazing therapist for many years that, helped me with that and did a lot of art therapy and other techniques. But that's, that's definitely an important component of this. If you still have trauma there, because we do store it in our bodies, and like numbness can be a very, very common thing when we've had trauma. It's almost like the body goes into, that we have like fight, flight, and freeze. And numbness in some ways from a trauma perspective is almost like that freeze. It's like that body goes into shock. And our tissues can actually become numb. And, and I wouldn't recommend what I'm about to say without having some sort of, therapy for any emotional stuff that comes up. But, some things that, can help even in that standpoint is like, is actually like inserting a finger intravaginally and just breathing into, like finding numb spots and just breathing into that tissue and sending love and sending energy into that tissue and just telling that tissue it's going to be okay, can really waken things up. Another thing that can help is actually, if you have a finger inserted, it's just to kind of windshield wipe your legs. If you're laying down, just windshield wipe them. You can actually feel the muscles contracting in that scenario. When you start feeling the muscles contract, it starts actually kind of connecting the neurology, right? Reconnecting the brain to actually begin to feel these areas intravaginally that may have become numb, that you have some dissociation to it. And that's why I say it's good to do these exercises if you have a history of trauma and you don't feel totally resolved around it yet. It's good to have some, a therapist to help you just in case there's a retracing, a remembering of some of these events that maybe the memories are stored in the tissues. It can be a good thing to have a guide to help you process anything that comes up. But, it is an important part of like waking these tissues back up because they can store memories of trauma.
Yeah. So there are a couple of different things here. I am going through my own, transition, right? And it's just part of life. But as I do that, and also as I have gone in and have created, sort of my little fun project that I'm in love with is Soulful Conception, which is preconception planning, right? As I'm going through all of these different places and learning and talking to experts and talking to people about my own health, I had a pelvic floor exam, which I've never had last week, which is it's so interesting because that's what it is. It's all the physical. It's the what is firing, what's not firing, and the connection of the brain to the muscle tissue and to the rest of the body. What I find so often though is, I said this last week with my guest last week, but it was, we go through life without truly understanding our bodies. those parts of our bodies, right? We have sex ed. I don't know if it's fourth grade or fifth grade or whatever grade it is. And so you get the little sperms and you get the eggs and whatever. You talk about a period. But we don't have really good education on our body. We just don't. You know, we go through these different parts of life going, I don't really know what this means or what's happening or why. And I think that, you know, it goes back to kind of like I say with a lot of things, you know, we have become so much more disconnected, and bringing back that connection and learning what it is that our bodies are telling us and bringing back the connection to those places that we sometimes try to forget, whether it's because of trauma or because of embarrassment or whatever the case may be. Those are all things that should be addressed. But bringing back that connection, I think, is really, really important in understanding and living life, enjoying life, right? I mean, we're here for such a short time. We have so many big things to do. And that's a part of it, is being connected to our bodies and what our bodies are trying to tell us and what they're doing for us. You know, our bodies are gifts.
Yeah, and I think it's such a like, yes, you know, life is here, you know, hopefully for a purpose and for helping others and for making an impact and for, you know, whether that's, you know, small or big. Like we all have different purposes of being here. And while that's true, I also think life is here for pleasure. And, you know, it's here for growth. It's here for good times and hard times and learning, and like, you know, it's very colorful, but one of many different components it's here for is pleasure and enjoyment. And, you know, and that's part of like while we go through as humans a wide variety of challenges and hard times and things that, you know, really, really sometimes can shake us to the bone, there's also the opportunity to tune into pleasure, to use pleasure as a way of navigating even those hard times with a little bit more ease, with a little bit more grace, a little more dopamine for happiness, you know, and joy, right? Yeah. And I think, you know, one of the things that sometimes is like thought about with pleasure is like, you know, hedonism almost, like around like, oh, like, you know, we should be, you know, suffering and like, you know, we're here to suffer. And like, there's almost sometimes a stigma that can get put on pleasure that's negative around like, you know, you shouldn't have too much fun. You should really be here like working. And I think that we can see this sometimes in even various spiritual communities. And yeah, I do agree with you know, with some, you know, spiritual teachings of like, yes, there is growth, there is learning, like we sometimes grow the most during the challenging times, but we get through the challenging times with more ease, with tuning into the gifts that pleasure, you know, gives us. And, you know, it's interesting in, you know, the conversation around like, oh, we're not taught this, like you were just saying, where I started thinking recently around like, okay, back to when I was in naturopathic medical school, what did I learn about pleasure? Well, in classes where we learned about males and male symptoms and male pathology, we learned about like inability to actually form an erection, lack of spontaneous erections, erectile dysfunction, you know, inability to actually ejaculate, all these root causes that are related really to ability to have and enjoy sex. In female class, we learned about PMS. Yeah. We learned menopause. We learned about, you know, a little bit about vaginal dryness at menopause. And that was largely it. Yeah. Like there was nothing about orgasm. There was nothing about pleasure. There was nothing about like that area of the body not working. There was nothing about anatomy. And so that was like really, really interesting in thinking about that of like, even in this day and age, you know, it was about 20 years ago now when I was in medical school, but even at this day and age, even 20 years ago, and I don't know exactly what's being taught now, but even 20 years ago, like that was what we were being taught as far as female sexuality. It was like basically nothing. So we're still at this age where I think it's like there's so much more information that we need to put out there and so much need for this because it's not even in our programs.
Yeah, no, I totally agree. I feel like as women, we could cope with a lot of things a lot better if we had some understanding. And starting out, I don't know that I agree that these things necessarily need to be taught in the classroom, but that's a whole different topic. But I do think that having something to help us, to give us some guidance, because we just don't. So I totally agree. Super curious about your new program, about what it is that you're doing, how you're going about it, how you're reaching people, mostly because we're running short on time, unfortunately. And I also want to make sure that if there's anything else you want to hit on, please do. But this is such an important program. And so I really want you to tell us all about it.
Yeah, and basically what I've created is a community. So it's basically a community for people to get support in the physical, mental, emotional, and spiritual side of things related to libido. So essentially in the community, we talk about lab tests to order. I give you links where if your doctor won't order the lab test, you can actually order them direct to consumer under my account with discounts.
Yep.
So there's direct, so you have the ability to be like, oh, I can learn how to make sure I'm good on these things. We teach about what the labs mean, what to do about them, how to repair hormones, gut, other root causes of inflammation. There's educational videos, and then there's also products that are designed to help you, heal from any lab test. So that's kind of from the physical side of things. And then we teach on how to communicate, how to actually get yourself into a better body image, how to support your own embodiment practices, how to talk about this, how to explore this, what turns you on, what turns you off. And really, just about anything, it's like when it comes down to trauma, that's not something that I have the ability to walk people through. So other than that, it's a very open dialogue for people to feel safe, bring their questions, bring their, things that have worked, support the community, and really just feel normal. So that's largely what it is. It's a community where you can bring your sex questions, where you can bring your libido questions, where you can get to the root causes, get support, and feel normal, feel validated in your own experience with libido.
Yeah. I think it's so important. My assumption is, and I probably shouldn't assume, but that you have people who if they have trauma that they need to work through, that you refer to.
Yeah. And I have local people for sure, and then and then if it's not somebody super local, then recommendations on types of therapies to look for, those types of things. So you don't like somebody or somebody doesn't resonate, then we talk about like, okay, well, what types of therapy tend to be most effective for the variety of things that you might be looking for, because not all therapeutic method is, I know we both know is the same.
Yeah, it's very different. And, somebody can, have what am I trying to say? There might be some really great people out there who can help, but not everybody's great for everybody. This is why everything is so individualized, and it's so important. I love that you're creating this community that is open for people to talk, to connect, to learn, to understand. I think that what I want to do is put a link. I have a resources page on my website, and I think that something like this would be really beneficial for people.
I would love that. Thank you.
Yeah. I think it's important to have resources, and it's part of it's a big part of why I do the show, is so people know that there are resources, there are things outside of the conventional that can be really beneficial and really helpful, and can again help to build that team, build whatever it is that you need to get you wherever you want to be, wherever your goals are. People are out there who can help and have such gifts of again lifting, right? It really, that's what it's all about. It's about lifting. So and creating an amazing world. There's there's a lot of negativity out there, and I'm like, nah, we don't need to do that. It's bring the good, positive, fun stuff. And this is the good, positive, fun stuff. Sex is good. Sex is positive. Sex is fun in a healthy way. And so if there are situations where you're not understanding your body, if your libido has changed, if you're unable to communicate, if you just don't know, then this is a great great community to reach out to. Dr. Mueller, you're awesome at what you do. I just love what you're doing. It's really cool stuff. So
thank you. You too, Nikki. It's such a pleasure to talk to you again.
Yeah. Make sure, so we want to make sure that people know how to find you, where to find you, whether it's for Lyme, whether it's for Libido, whether it's for a combo, because it can happen. How do they find you?
Yeah, so if you have anything more chronic, Lyme, mold, chronic inflammation from a standpoint of like autoimmune disease, that sort of thing, you can check me out at mylymedoc.com. If you have anything libido going on, then you can find me at thelibidodoctor.com. And that's really how to get a hold of me. You can also find me under my name, drdianemueller.com as well. So any of those resources and you'll get to me.
Cool. Yeah. No, it's really good. And I was checking out your Libido website this morning, and it's just really nice. It's really great and informative. And I just, again, I don't mean to be repetitive, but I am. I love that you're doing this. So good stuff. Of course, you can find me at tastelifenutrition.com. There's a free assessment on the website, and I'm happy to then reach out to you. We'll chat, one-on-one about what's going on. We'll see if I can help, or we'll see if we need to refer you to somebody like Dr. Diane, which is, again, why I love what I do. Surrounded by amazing people who do amazing things. So, all the social media, Taste Life Nutrition is everywhere. This will also be the Taste Life Nutrition podcast. We're streaming live every Thursday at 10 a.m. Mountain Time. And then, of course, we have, which I hit on a little while ago, but Soulful Conception, which is purposeful living for a healthy body, a healthy baby, and a healthy pregnancy. I have found this to be it's such a key factor in creating our own health, but being empowered and understanding that I have the ability, as I say, me as the general we, right? So if you are in that phase of looking to grow your family, being as healthy as you can be today will impact your pregnancy. It will impact that child, and it will impact generations to come. And I want women to have that power, to know that they have that power, because it's really, really beautiful. To take into, I think so often we sit back, we're like, I'm just one person, what can I do? And we can do so much. It is in our power. We have an amazing amount of power, and that's what I want with this program. So if you have questions about it, feel free to reach out. Happy to chat about it. I would say, in a sense, it's also what I'm hoping is going to be a little bit of a community. We're slowly bringing people in. But it's I would say it's a little bit similar, also obviously very different topics, but kind of similar in bringing women in to connect, to learn, to understand, to learn their bodies, what it is that they can do to move through that process as healthfully and as empowered as possible. So thank you again, Dr. Diane. I appreciate you so much. If you'll stick with me for just a second, then we'll see everybody next Thursday, 10 a.m. Mountain Time, streaming live, KUHSdenver.com. Thanks, everybody. Bye.